As we have discussed about the terminologies related to the labor, about the presentation, position, engagement, full dilatation, crowning, and station. Now we are going to discuss about the anatomy of the maternal pelvis. The maternal pelvis basically consists of three parts: the pelvic inlet, the pelvic cavity, and the pelvic outlet. The pelvic inlet is anteriorly lined by upper border of symphysis pubis. Suppose this is the pelvic cavity and this is the pelvic inlet. The pelvic inlet is anteriorly lined by the upper border of the symphysis pubis. It is laterally lined by the superior margin of the pubic bone and the iliopectineal line. The iliopectineal line and the superior margin of the pubic bone, and posteriorly it is lined by the sacrum. So the pelvic inlet anteriorly lined by the upper border of the symphysis pubis, laterally lined by superior margin of the pubic bone and iliopectineal line and ala of the sacrum, and posteriorly by the promontory of the sacrum. While its diameter in this plane is the transverse diameter is 13.5 centimeter and the anteroposterior diameter is 11 centimeter. This diameter of the pelvic inlet is larger, that is 13.5 centimeter, while the anteroposterior diameter is smaller, that is 11 centimeter. So the head will, during the mechanism of labor, the head will engage in the transverse diameter in the pelvic brim. The head will enter in the transverse diameter because the transverse diameter is wider. So the head will enter. This is the head, and this is the transverse diameter of the head, and this is the most longer diameter or the most larger diameter, and the head will enter to the pelvic inlet by its transverse diameter. And the relationship of the transverse diameter of the head with the edges of the pelvic inlet, with these edges of the pelvic inlet, is basically called the engagement. Then, what is the pelvic cavity? The pelvic cavity is anteriorly lined by the symphysis pubis, the medulla of the symphysis pubis, laterally by the pubic bone and the ischial and the inner aspect of the ischial bone, the pubic bone, and the ischial spine, and the posteriorly by the second and third aspect of the sacrum. This is the pelvic cavity. This is the medulla of the medulla of the pubic bone. These are the inner aspect of the ischial bone, the inner aspect of the ischial bone, as well as the inner aspect of the pubic bone, as well as the obturator fascia. The obturator fascia, the pubic bone, and the inner aspect of the ischial bone, the ischial tuberosity. This is the ischial tuberosity. This is the ischial bone and its inner aspect. This is the pubic bone, and this is the obturator fascia. And posteriorly the second and the third part of the sacrum, this lines the pelvic inlet. And the now coming towards the diameter of the pelvic inlet, both the anteroposterior diameter as well as the transverse diameter in the cavity are equal. In the pelvic outlet, anteriorly the pelvic outlet is lined by the lower margin of the symphysis pubis, laterally by the descending ramus of the pubis bone, the ischial tuberosity, the sacrotuberous ligament, and posteriorly by the piece of the sacrum. So coming towards the pelvic outlet, in the pelvic outlet posteriorly there is last piece of the sacrum. Laterally there are pubic bone, descending ramus, ischial tuberosity, and sacrotuberous ligament. Descending ramus of the pubic bone, from below we have to look at the pelvic outlet. So the descending ramus of the pubic bone, the ischial tuberosity, and the lower part of the sacrum, and anteriorly the lower margin of the symphysis pubis form the pelvic outlet. The diameter in the pelvic outlet, the AB diameter is longer that is 13.5 centimeter, and the transverse diameter is shorter, that is 11 centimeter. So the head have to rotate to the anteroposterior diameter at the pelvic outlet. The head will engage in the transverse diameter, then it will descend in the pelvic cavity. Then at the pelvic outlet AP diameter is longer, while the pelvic outlet transverse diameter is shorter. So the head will rotate to the anteroposterior diameter, that is the occiput will touch to the symphysis pubis, and the frontal bone will towards the sacrum. This will be the AB diameter of the head.